super excited to be chatting with some medical professionals in the Fat Girls Traveling community. There are so many questions that members had, questions that I had personally, questions that just as a fat community that we thought were really important to talk about with medical professionals, especially people of size, other fat people in the medical industry and community. And so I'm super excited to be joined by OG Fat Girls Traveling member Amanda. Amanda, do you want to introduce yourself and tell everyone who you are, what you do, and why you're excited to be chatting with some other members today?
Hey guys, I'm Amanda, and like Annette said, I've been there with her from the beginning when I first started traveling as a digital nomad 3.5 years ago in Italy, and now I'm living in Bristol, United Kingdom with my husband, and wasn't planning to not travel, but I guess we all aren't, and I'm really excited to talk with everyone because I don't know about you guys, but I already have anxiety, and we're in the middle of a pandemic, and it can be really strange times when you're reading all these news and you're dealing with fat phobia. And then on top of that, you start to read articles about how being fat can impact you. And it's just with the virus. So I'm really excited to ask a few questions, but mainly learn and get some answers. And yeah, so that's me. And you can follow me at WellFat, and I also write for the Fat Girls Guide, the official Fat Girls Traveling blog. Should be following it if you don't.
Yes, Fat Girls Guide shout out. And so now I want to introduce you to all of the incredible women who are in the medical industry and on the front lines fighting this virus and just putting themselves out there, giving us their time right now to educate us about fat phobia in the medical industry.
My name's Kendra. I'm originally from Kansas City, and I'm a travel nurse, medical surgical nurse, and I'm currently in the LA area. I'm working night shift, and I have been working with COVID positive patients, kind of off and on because my unit and the COVID unit are technically like sister units, so I go back and forth between the two.
Real quick, what is a traveling nurse?
So we start with usually like 3-month contracts anywhere in the US. Some do international traveling, and we work with an agency that places us with a hospital that might have a need for a nurse. So I've been to Reno, Nevada, I've been to St. Louis, Missouri, and now I'm in LA. I've been doing it for about 2 years now.
I'm Sophie Nick. I'm a traveling nurse as well. So I work as a contract all over to different hospitals, just like Kendra does. I'm also from Missouri. I'm from St. Louis, and I am based in Los Angeles right now. And I work as a pediatric ICU nurse, and I specialize in cardiac defects of children. I have worked with some COVID patients right now, but as we were finding out, it doesn't hit pediatric population as hard, and it doesn't go as quickly as it does with adults. We're finding it to be a delayed effect, and kids have this really interesting mechanism where they will compensate until they can't compensate anymore. So if they do end up coming to us, they are usually a lot sicker than if they would present if they were an adult. So we have had some, but right now we are just trying to be really conscious about it, about who we have in our ICU, so we can make room actually for the adult patients that come into our ICU, because we share with an adult hospital. And that is where I'm at.
I guess I can go since I'm also a nurse. But I am working at UCSF in San Francisco. I work on the med-surg neuroscience unit, but right now the Bay Area did a really great job of flattening the curve, and so our hospital capacity is at like 40%. So I haven't done direct patient care in about a month because I'm per diem. and the priority shifts go to full-time staff. And so right now, I've been redeployed to work as a screener for anyone coming into the hospital. We initiated a policy about a month ago where anyone entering the threshold of the hospital needs to have a mask and has been screened. And so, we ask everybody symptom-related questions, travel-related questions, and exposure-related questions. And then everybody wears a mask and they come in the hospital. So we're talking about, now we're getting to a point where people have pushed their planned procedures or surgeries or admissions or whatever back long enough that they can't wait any longer. So we're getting a lot more admissions for things that are not COVID related. We do have COVID patients, and we have a specialized COVID unit that all the rooms are negative pressure and everything like that. And then obviously our ICUs. But it's nowhere near the amount of patients that a lot of other places, even LA has. And so things are changing on like a day-to-day basis of what we're going to do next and how we're going to handle all of this.
I can go next. My name is Jordan. I am a nurse by trade. I did oncology cancer clinical research for about 13 years. My current title is Senior Manager of Clinical Quality Assurance. I work for a tech company that started about 4 years ago doing something that was brand new, and we're basically the pioneer of offering clinical trials via telemedicine. So what we're doing right now is a whole lot of COVID coronavirus testing, clinical trials. We just launched global testing. So we have trials in Italy, France, Germany, and the States as well. But because I'm no longer on like the bedside of things, I'm not actually treating the patients. What I do is I make sure that all of the people who are interacting with the patients are doing everything per regulations, per guidelines. So quality assurance means I'm helping all the way from studies, what we call study startup. So making sure that the protocol itself is written in a way that makes sense, that's ethical, and follows guidelines to make sure that the patients are kept safe. And then throughout the whole duration of the trial, I'm sort of just monitoring it to make sure everything is being done correctly. I'm based in Los Angeles. Like I said, we're working globally, so we are pretty high demand right now. But when I worked as an oncology research nurse, I worked in Detroit, Los Angeles, and out in the, it's called City of Hope, one of the top cancer research centers in the States.
Okay, so I'll go next. Can you guys see me on the screen? Like I've done the Zoom thing before, but not really before. So, okay, great. Hi guys, I'm Jazzy, AKA Dr. Green. I'm a veterinarian out here well, I moved to Costa Mesa, so like Orange County area. So my patients are your cats and your dogs. My clients are your patients, the humans. As far as the coronavirus thing goes, in veterinary medicine, it's a little bit different just because like cats have their own coronavirus that we've been vaccinating against for years. And dogs have their own coronavirus that we've been vaccinating against for years. But the human coronavirus is something totally new, totally different. So we're taking a lot of precautions with that as well. And I think a study came out in China a week or so ago that said that cats can get coronavirus. So, we're taking our precautions, and mostly right now we're just trying to limit our interaction with the clients, which is a lot more difficult than it seems, because we're like, hey, we'll go out and meet you in the car. And they're like, no, I want to bring you my cat. And I said, no, I want to meet you in the car. And they're like, but why? And I said, coronavirus. So we're trying to deal with it in a different way, but I'm here to answer any animal related questions you have about it, and also to ask questions to hear the human side of things, because that's the one thing that I don't get to hear very often.
The second question that I had was that I felt like, as a patient in the medical, industry, as someone that has to go to the doctor if I'm feeling ill, I definitely feel like there is some fat stigma and some fat phobia. And I think that there are a couple industries that are sometimes feel like society feels like they're above reproach, which is like, I think, police and doctors. But I think that you guys have a unique point of view or perspective.
I wrote about this as well in my blog, if you want to follow me at nursemurderer.com. I'm not a murderer. I'm a nurse. I save lives. So I feel like it is very difficult as a fat nurse, especially in Los Angeles. I feel like, as we know, different parts of the world are more accepting of body shapes than others. Los Angeles, as we know, is, Hollywood glamour, etc. So it's all supermodel jams. As a nurse working at one of the top hospitals in Beverly Hills, I'm not going to name any names, but I'm sure everybody can figure it out when I said Beverly Hills. It was horrifying. It was literally a daily toxic environment of just navigating fat phobic comments left and right. A lot of it was, I think, unintentional, but that is actually where I first started getting comfortable of pushing back on it. I had instances where I would, catch colleagues that were discussing their juice fast, that they were literally doing it, and they said because they didn't want to get fat. So I say, well, what's wrong with being fat? And, just looking at them, then of course they're kind of caught off guard. So from just a personal standpoint of being a fat nurse in the community, where all day we're talking about weight and BMI, and things that we know as fat folks are set up to discriminate against us, it definitely created an uncomfortable, toxic environment. That being said, I have found when I push back, a lot of folks are more open to having a dialogue about it, especially in the medical community. So I've been able to, I hope, maybe educate a few folks here and there, at least refer them to different research than the ones that were taught in school, because there is a shift, I would say, in the community where they're starting to become a little more aware and open to the idea. We are already, which I know we're going to talk about later, BMI, but the community is aware that BMI isn't a true indicator of health. So I think we're sort of tiptoeing into an area where we can start having honest discussions as medical professionals about fat phobia, weight shaming, etc. But we are in no way or shape or form there yet. Not only as a patient seeking healthcare, but also as a nurse working in the community. It is definitely a real thing.
I can kind of talk about my experience being fat and being a nurse. When I go in for my annual physicals, usually it's with a service that is not my primary care doctor back in Kansas City, because I'm not located in Kansas City. So this is a doctor who's never met me before. And I remember one time, like, some of the first words out of this doctor's mouth was, "Oh, have you ever considered bariatric surgery?" And I was just like so taken aback, because I'm like, one, you don't know me. You don't know who I am as a person, where I've worked. I used to work on a bariatric floor. So I saw all of the complications to surgeries. I saw some success stories with it, and the patient's goals, not necessarily what we would consider success, but for them it was successful. So I was just really floored by her comments, and I was like, you know what? I don't need that type of guidance today. I'm here for a physical. you literally know nothing about me other than what I've written out on my form today. So I'm a nurse. I work as a nurse. I just need to be cleared to continue my job and taking care of others. And I've also noticed that when if I were to have like a sinus infection, which I get a couple times a year, when I go into like an urgent care, doctors I've noticed their body language, and this could just be a doctor thing, because doctors can be a little off sometimes, but it's like they don't make eye contact, or they sit across the room from me, and I don't mention that I'm a nurse until the end of the conversation usually. And that's when they like kind of change their disposition with me when I do mention that I'm in the medical field. So it's like, I don't know if I'm taking it personally in the beginning, or if it's really like they're noticing, oh, you work in the medical field, you know what I'm talking about. So it's just kind of frustrating being fat and like interacting with doctors sometimes.
I'm curious, do you guys feel more like pushback from patients or like those that you work with? Like, is that a thing? Like,
For me, it was more as a patient interacting with my own healthcare providers. My patients, I mean, just as I'm sure you could expect, if you see someone that looks like you helping you, it brings comfort. So I never got pushback from patients. I mean, I guess you could say that there might be, I've had, smaller size patients that think, oh, this fat person's taking care of me. But I think I've never had any problems where I've never had bias with a thin patient, upset that a fat nurse is taking care of them. I luckily have never had that. But yeah, on the flip side, I've only ever had patients very happy to have someone that looks like them helping them.
I think it's really interesting as well for the medical community being like a bedside nurse or working as a nurse. We see doctors in like all of their stages. And I feel like the general public doesn't realize that just because you have a doctor in front of your name doesn't necessarily mean like you have all the expertise and experience you need. And I think that they don't realize that there's this hierarchy that like, you're a med student, then you're an intern, then you're a fellow, then you're an attending, and and then you have to be like the big boss. And also there is, I feel like maybe this unconscious acceptance that like medicine is rooted in like old white dude language and bias. Like the language that's used in medicine is Latin based. Like who even takes Latin anymore, and like these sort of patriarchal and outdated ideas that we are just now kind of catching up to and becoming more aware of as women in medicine, their voice becomes more prevalent and they get better platforms and have more opportunities to speak and people listen. I think that they provide a lot of insight and I can't finish my thought, but like they provide a lot more insight into the community and a better perspective, which kind of just pushes of why we need diversity, people of color, women, all type, like genderqueer, like all types of people in medicine, because medicine doesn't just serve old white dudes. So I think that's really, really important to understand as well. And that's, if I could do anything, that's what I would want the general public to understand, that there are lots of people in medicine, but the main voice that has been so prevalent for hundreds of years is that voice, and we're working towards not having that be the most prevalent voice as well. And I'll echo the fact of with Jordan is that I've never like had a pushback being a fat nurse, being somebody like, I don't want that nurse, but I have definitely 100% seen the flip side of being a fat patient and being treated that way. And not being listened to, not having your voice heard, people underestimating your pain levels, underestimating what you need and how you feel, and just kind of constantly second guessing you. And I've seen that projected on as well from the other, like doctors projecting that onto their own patients that they have as well, and trying to be that voice of reason to step in and say like, hey, maybe there's a different side. You should believe them. If they're saying this, then what's the harm in investigating that route, you know? And we're trying to advocate what's best for that patient. So yeah, that's all I got.
I guess I can go next. So I feel like I don't know if it's because of the areas that I've worked in. I worked in Atlanta on a forensic unit, meaning my patients were all inmates, and then I've worked at a neuro unit in San Francisco. So the weight issues, I honestly, I haven't really noticed it very much in my personal history. I feel like a lot of my self-image issues come from my personal life. So I've never really experienced it professionally. If anything, I have patients that are like, I want her to take me to the bathroom because she'll catch me if I fall. Yeah, I've never really experienced that, but I definitely think it's very prevalent to change the discussion between, weight being a risk factor versus weight being like a death sentence. Your weight and your health is not, directly, it's not one means the other. You can be overweight and you can be healthy. You can be obese and you can be healthy. You can be fat and you can be healthy, whatever you want. Health is a relative term. And so I think that's part of where I try and educate people is when they say, well, that's not healthy, is say like, what do you mean by that? Like, what do you consider healthy to be? Because health is not the same for everybody. Healthy for like a healthy diet for a diabetic patient and a healthy diet for a patient who suffers from Crohn's disease is going to be completely different. And so, yeah, I guess just trying to just change how people see weight as it relates to health. And then also, I think another, maybe something that has to do with my experiences is the places that I've worked have been incredibly diverse. And, San Francisco particularly is known for people of all shapes, sizes, and colors. And so I think it's a part of what makes that city special, and particularly our educational center, our medical center, is that everybody is so different and you're getting all sorts of different perspectives. And so you're not seeing all of one view, I guess. I feel like I'm rambling, but hopefully that made sense.
So it makes total sense. And I think also just kind of going back to what your current kind of work environments or stages are too, is how are you guys handling like PPE with your patients? And follow up, what is PPE, just for those who might not know, but also is your hospital providing it if they have none, or like what is kind of your situation with that?
I can speak to this. My hospital, I believe we are doing a really good job at protecting our nurses as well as our patients. They limited visitors, restricted visitors from coming in the hospital several weeks ago. They started screening a couple of weeks ago our temperatures, and we have to wear a mask inside the hospital at all times. As far as PPE is personal protective equipment. It's our mask, it's our face shields or goggles, it's our gloves, it's our gowns. And if you're lucky enough, you get to wear fancy hairnets too. We look really attractive in our PPE, just saying. But on my unit, when we take care of patients, our general ratio is 5 patients to 1 nurse without COVID. On our COVID unit, And for medical surgical, we're only taking 3 patients at a time, which is really nice because it takes time to don and doff our PPE. That's to put on and take off our PPE. And we're going in the room by ourselves. We're doing our vitals. We're cleaning up the patient. We're cleaning the rooms, pretty much all by ourselves, which usually we have like a CNA, nursing assistant, to do our vitals for us on our non-COVID unit. So that's where the fact that we've been able to reduce our ratios is really helpful, because then we're able to protect ourselves and take the time to protect ourselves. Where I have travel nurse friends who have been in New York, they've been in Brooklyn, and they're taking 10 patients at a time with no help, and they're all much more critical than my patients. So I've heard some horror stories across the nation from my friends about what their hospitals are implementing, and I'm very fortunate to be where I am right now, because I feel protected. They're starting a new protocol for the N95 masks. We're going to be receiving 4 masks per nurse, and we kind of rotate them. I think they've looked at studies on how to do that properly. But our rooms are not negative pressure rooms unless if they're like intubated or getting highly aerosolized treatments. And I'm not on a unit where that's happening. So our ICUs, the nurses are wearing N95s, where up on our medical floor, we're just wearing yellow masks. So,
So you guys are following like precautions and speaking of kind of like precautions, this might seem a little random, but grocery shopping, should I be disinfecting my groceries? Is that too far? Is that not far enough? Like, what is kind of, as someone not in the medical field, and, you know, also as an American living in the United Kingdom, like in America, everyone's told to wear masks when they go outside, no matter what. But in the UK, that's not a thing. So I make my I was about to say boyfriend, my husband, wear a mask when we go out, and he hates it, but he does it because it's like, it's weird, the different messages. So one of those messages I heard was, you should be disinfecting your groceries. Yay? Nay? Is that true?
For me, I have not been doing that. I go to the grocery store. They're making us wear masks inside the grocery store. So I have my hand sanitizer. They're cleaning the carts for us, which is nice, at my grocery store down the street. So I have my mask on. I do hand sanitizer before I touch my cart. And then I grab my groceries throughout the store and then check out, put them in my car. I wash my hands with my hand sanitizer again, take off my mask. And if it's a disposable one, I throw it away. If it's a cloth one, I have a bag that I put it in my car so I can wash it later. But that's just what I've been doing. Anytime I'm about to touch my face or take anything off my face, I'm washing my hands. So that's my recommendation. I think Jordan's talked about that on her social media, so maybe she can go into that a little more.
Yeah, I did a video and post how to properly doff the mask, which is taking it off, because I think that's a big thing. And just being out, like you said, in the States, especially in California, it is required that you have to wear a mask whenever you enter any public space. So as a healthcare professional being out in the streets, I've seen people doing everything wrong, which in fact actually makes it more risky and more dangerous. So as far as sanitizing groceries or we aren't doing that. I don't have any. That's actually my fiance just walked by. He's the one who's actually been doing the grocery shopping, but we aren't disinfecting anything. The only thing we have been doing is if we get food delivered, we take it out of whatever packaging it comes in wash our hands after. So like if we get takeout and it comes in a box, we'll dump the box onto one of our plates, wash our hands before we eat it. Yeah, but groceries, no. I mean, not like, you know, obviously your produce, whatever, wash it how you normally would. But the thought is with food, it's not living in food because of the heat. When you know, are cooking the food, it should kill off the virus. So, yeah, but again, like Kendra said, washing your hands is literally the most important thing you can be doing. Don't touch your face at all unless you have just washed your hands. So, yeah, sanitize your hands before you go to the grocery store. Don't touch your face while you're in the grocery store. Wash your hands after you put everything in the car. Wash your hands after you put everything away. Like, just continually wash your hands. And also keep lotion handy, because you don't want your hands all dried out. Us as nurses know that your hands get dried out from washing them all day. And all those little cuts and nicks that you get from it being dried out actually also can be more risky and give you a greater chance of catching an infection. So washing your hands and making sure they're moisturized is most important.
But can we touch our face when we haven't left our home for days and we've washed our hands? Because clearly I've already failed because I've just touched it again. Like what are, I guess that's actually a good kind of limit. Like when you go outside to when you're in home, is there kind of like the quarantine period from when you go outside to when you come in home? Like, you know, should you try to touch as little as possible for like the first hour? Like,
So I'm gonna answer this. So the way that I have explained it to my parents, who are both in their late 60s, is your home should kind of be your fortress of clean, you know? And so if you can prevent yourself from bringing anything foreign into your environment, that is the goal. So when you are out in public, I would try and not touch your face as much as you possibly can. People are adjusting their masks, they're uncomfortable, they're pulling it down, scratching their nose and then pulling it back up. Like that field is broken now. Your mask is not doing shit. Excuse my language. But you know, it's yeah, it's really enlightening to kind of see how people do or don't understand germs. There was a really great video of a nurse who basically used paint to show, like, okay, I touched this and then I, you know, touched my phone and now it's on my phone. And then later I touched my phone and I touched my face and now it's on my face. And so, and you know, if you haven't washed your hands in between touching the dirty surface and touching your face, then it's basically just went straight from there to your face. So when you're in public, try and limit touching your phone, try and limit touching your face. You know, if you can keep your phone like in a Ziploc or something, take it out when you get back into your house, leave the Ziploc and everything like in your trunk of your car or something like that. Leave the dirty stuff out of your house and bring the clean stuff in, disinfect it once it passes that threshold. And it will hopefully keep your space clean.
So I've heard a ton about hand washing. I'm 1,000% behind that. What about gloves? Like, people have been wearing gloves to the grocery store. Is that helpful at all? And then I know Jordan was saying that she's seen people do all the wrong things. Can you share with us what some of those wrong things are? I follow Jordan. I follow all of you guys on social, but I remember Jordan posting something about wearing your mask in your car. So can you guys just dig a little bit deeper into the wrong things? And does that include wearing gloves?
I think you probably saw every single nurse on this Zoom shaking their head no to gloves. Gloves are like, and I'm sure all of us can agree, we had to go through, like, we had to be tested on how to wear gloves. Like, people should not be out in the streets wearing gloves unless they had to pass the same test that we did. Because what I've been seeing is people wearing gloves to like touch dirty things and then literally touch their face with their gloves on, like just the dumbest things ever. when really you should think of those gloves as like they're covered in shit. Like that's the best way that I could think to explain it. Those gloves should never touch anything on your person, your car. Why would you then get in your car and touch your steering wheel? Like it just seems like, to me, gloves are a bad idea. Washing your hands is the best plan, unless you know exactly how to take on and take off gloves and when you wear them versus when you don't. I would always just say wash your hands. The mask in the car thing, to me, it just doesn't make sense because your car is a safe space. I mean, unless you are an Uber driver or have other people in your car, I just don't understand why people are wearing their mask in the car. That being said, the post that you're talking about and that someone did comment on it, like, well, I thought it's better than me messing with it to take it off. So I couldn't wash my hands, so I just kept it on. Okay, I understand that, but the idea sort of like, I'm sorry, I don't know, LB, is that right? LB? LB was saying, think of your
Sorry, I'm Lauren.
Oh, Lauren. Sorry, Lauren. Think of your house like a fortress. Also, you can think of your car like that as long as you are the only person in and out of your car. So you wouldn't want to wear dirty PPE in your car. So yeah, I would say no to the gloves, wash your hands. And if you are wearing a mask, make sure that once it's on your face, you're not messing with it, you're not touching it, because the whole outside of it is dirty. And the thing that I see the most that drives me bananas is people get a little claustrophobic or whatever, so they'll pull it down. And then they have it hanging on their face. Yeah, exactly like Kendra just did. So now you have everything that was dirty is now on your chin, on your shirt. Like you're literally just contaminated anything that you tried to protect yourself from. So that's a big no-no. Don't leave your mask half on, half off, and don't wear gloves. I suggest no gloves.
Yeah. I said to a coworker yesterday that some of these people have never had to learn how to insert a Foley with one clean hand and one dirty hand, and it shows.
Kendra, can you show us again how not to wear a mask? You
Sure.
have to make noise though, because the camera will only follow you when you're talking.
Oh, that's right. Okay, so, oh, this one doesn't fit as well. These were homemade and sent to me from my mother, so I don't want to use one of my hospital ones that I have to wear later this week. So this would be the proper way to wear your mask. It's covering your nose and your mouth. If your nose is uncovered, it's not proper because stuff can come out of your nose. If you sneeze, it'll come out of your nose. People are wearing them like under their chin like this, and that's obviously not protecting anything. So yeah, cover your mouth, cover your nose.
Also, something that we just learned the other day was a lot of people are wearing the like construction style, like pseudo N95, which is not technically an N95, but apparently that the valve in it that prevents them from inhaling particles and sawdust and everything is a one-way valve. So when you exhale, nothing is preventing your particles from going outside, which means it's protecting you from inhaling stuff, but it's spreading anything that you may have in your system outwards, which I was not aware of. And so, yeah, be aware of that if you're in close quarters with anyone who's wearing one of those masks.
I think it's important for like me and to educate people on kind of like the term obese and the BMI scan. Can anyone break this down in like a minute or less? Like, is that doable?
I can try to. So BMI stands for body mass index, and it's a scale that they came up with, I don't know how many decades ago, to establish your healthy weight. And so it goes off of height and weight, which we know as people that your body composition it fluctuates daily, it fluctuates monthly, especially as women. If you have more muscle mass, muscle weighs more than fat, so you could have a ton of muscle and your BMI be off the scale because you have more muscle. So it's really not the best tool for society to use in gauging whether you're obese or not.
There's also, if I could just tag on to it, there is a book by a sociologist out of, I think, UC Irvine, and it's Fearing the Black Body, and it's about the history of fat phobia. And she actually did a lot of research, and it's traced it back to basically like everything else in the world, it's all rooted in racism. So BMI was originally designed by a mathematician who also happened to be a eugenics professor. So as we know with eugenics, that's the hope of eradicating species that are less than desirable. So with this thing, with the BMI, it didn't actually pick up like steam and start being used until like the 60s, 70s, and 80s, whereas he actually created it in like the late 1800s. And now it's really just another tool of capitalism because our insurance companies use it. A lot of times they won't pay a doctor unless the BMI is included on the like after visit summary. A lot of insurance companies won't pay the doctor unless they talk about weight with the patient, talk about losing weight. So there's a lot of, a whole host of reasons why BMI is just not useful tool and not a key indicator of health, but it is also rooted in racism like everything else in the world. So. But Sabrina Strings, if you get a chance to read that book, Fearing the Black Body, it's really amazing. It traces fat phobia and like the first diets were all the way back when Protestants were trying to tell their fellow churchgoers to not be fat like Africans. So that's my plug for the day.
No, thank you for adding that. And this was definitely something that I wanted to talk about, and something that I would just ask the community to do more research on. Obviously, with all of the stuff that you guys are teaching us, I want to thank you for educating us, but obviously it doesn't stop here. I think that there's so much stuff that we can learn. And one of the things that was important for me to learn through this whole BMI thing was also the introduction of the term obesity, through like diet culture and how obesity and BMI kind of play hand in hand with each other, and kind of how those are medical terms that are kind of used against fat people, but they were actually created by the diet industry to make money off of people, which is no surprise to any of us. But I would definitely suggest, if you aren't familiar with any of the stuff that we're telling you about, obesity and BMI and that kind of stuff, please look into that. I wanted to make sure that we highlighted that in this conversation, just because those are terms that I try not to use, just because I feel like they are, go alongside with diet culture. And that's something that I'm trying to fight with, my everyday life and with this conversation and with, this community. One thing that we did skip, though, that I wanted to circle back on just before we get into the meat of this conversation was wearing masks when you go out and you're jogging or when you're walking. How important is that to do? Like if I were to go for a walk or to go for a hike, should I be wearing my mask? Should I just be making sure that I'm within that 6-foot distance? And is there anything I should be doing like when I get home from being in public besides like washing my hands?
So, as kind of like a rule of thumb, if you're going to be like some of these trails and parks and everything where people are exercising, because that's like the only way that they can go outside besides going to the grocery store, they're packed. And it's kind of like, oh God, should we really all be here? And so kind of as like a rule of thumb, if you can't distance yourself from other people, you should wear a mask. So not necessarily should you be wearing it while you exercise. And I know that's really hard for a lot of people. But if you, I would definitely have one with you, so that if you're in an area where you can't avoid anybody else, you can put it on. And then there's all sorts of information as far as like, is 6 feet enough when you're exercising? Because people are running, people are bike riding, people are exhaling, and the particles are flying all over the place. So ideally, just maintain your distance as much as possible. If you can wear a mask, do. And yeah, it's kind of a gray area, especially because there's so much we don't know about this virus.
Yeah, to tag on what Lauren said, I saw something that said if you're bike riding or running in an area where there are other people, that think about actually 10 feet being the rule. Because like she said, with wind blowing, anything that someone's coughing or sneezing is blowing right at you. But if you are not in a populated area and you just have a whole bunch of woods out in your backyard, you don't need to wear a mask. But yeah, if you're going to be at a park, I go to the park sometimes, and exactly like we know it's busy because people are freaking out because they need to get outside. And so I always bring my mask with me because inevitably someone is going to walk up near me. So it's, yeah, best to have it if you're going to be in a populated area.
Yeah, I went for a distance walk with my mom last weekend, and just because we're both struggling not being able to see family and stuff, and I snapped at her because when we were at the parking lot where this trail started, there were so many people and she wasn't paying attention. She was looking at something on her phone. I was like, Mom, I need you to pay attention. We need to go. We need to walk away from these people. And you know, I said afterwards, I was like, I'm sorry I yelled at you, but I need you to pay attention to people being around you. So yeah, it's tricky.
Yeah, I just recently moved out of my apartment because I lived with 2 other nurses, one of them being pregnant. So we were all just kind of trying to separate ourselves from infecting her or bringing it home to each other. So I moved into an Airbnb alone, but I'm right by the beach, which is like my favorite place to be. The beaches are closed, but there's like a park on the street side, and I want to go out there more than I have been, but with it starting to get really nice here in Southern California. I go out on the cloudy days because I'm from the Midwest, and I'm like, this is still warm and there are less people out. So the sunny days I try to avoid, or I go at times where there aren't as many people out, because there are still a ton of people out running, playing frisbee, playing football. I'm just like, you're just spreading germs with those sports, but okay. So, but that's been like kind of my saving grace, is to be able to go outside, because I am kind of on the front line of things and I'm going stir crazy in my little studio Airbnb. So it's like, you want to be able to get your mental breaks in, but also protect your physical health as well.
That is so true. And I definitely want to now dig into kind of like the big question, and the question that I know a lot of the members of the community are wanting to know. If you are fat, does that automatically put you at a higher risk of contracting COVID-19? And like, what, if any, risk is there, you know, compared to a straight size person?
I can kind of start with this one. I think it really depends on what other medical issues you might have. Being fat in itself does not put you at higher risk of contracting this, I believe. It's whether you have like high blood pressure, if you have breathing issues like asthma, if you have another like autoimmune disease. I know a lot of people struggle with that. So it's really if you have those other comorbidities that if you do get it, it might affect you harder. If that makes sense?
So do you think should like fat people be more careful in any specific way than any other demographics?
I do not think so. Again, like Kendra said, it just depends on what other health conditions you have. If you're a fat person that has absolutely no health conditions and you're a healthy person, you should take the same precautions as anybody else. Just to sort of re-emphasize what Kendra said, anyone has the same likelihood of contracting coronavirus. Anybody can get it, and it can affect anyone. The people who are having the more serious outcomes are the ones that have other comorbidities, other health conditions. So there is a lot of, push in the news. They're saying that obesity is a risk factor for it to be more severe, but that's because they're looking at obese. I'm using that term because of the medical community. That's not my term, because they're saying that obese patients also have those other comorbidities. That's not always the case though, as we know. So if you are just a fat person and that's it, and you have no other health problems, you take the same precautions as anyone else. But when you start getting into, you have diabetes, or you have hypertension, or you have lupus, or you have, any other disorder that you can think of, that's when you need to be considered a vulnerable population and taking extra care of yourself and really ensuring that you're following all of the guidelines.
I definitely would agree with all of what those ladies said. And then just wanted to also add that like the breathing and lung issues is like one of the biggest concerns. And with that, just sheer weight can cause that to be an issue. Like people with obstructive sleep apnea can be purely because you just have a lot more weight on your body. And so that, like I have big boobs. And so when I lay back at some point, I'm like, oh, I can't breathe. It's that kind of sensation. But does it put you at a higher risk of contracting it? No. Does it mean that you might have a little bit more issue with ventilation should you get it?